My name's Dr. Lynn Lafferty, and I am a clinical pharmacist and a naturopathic doctor, and I have a practice in Boca and also in Miami, Florida. I have several different types of patients. I have patients that have, probably my three biggest types would be people who have hormone imbalances that are probably ages 40 to 60. And then I have a lot of children with GI disturbance as well as adults. And also I get a lot of people with different skin conditions. I get many referrals from physicians who are, they are aware that there's other tests and other modalities of treatments, but they don't know, might not be able to order them or may not know about them, so they will refer to me. And as a matter of fact, about 20% of my patients are medical doctors. Yes, I use the ALCAT test. I especially like to use it with people with GI disturbances and also with skin conditions, because we know a lot of the skin conditions can be caused by GI problems, and also things like autoimmune conditions they're finding in clinical research. If you go back even 25 or 30 years ago, that for instance, people with celiacs have many more times Graves, the autoimmune diseases of the thyroid and things, than regular patients. So we know that there is a high correlation between GI and other diseases, and it's in the literature. Absolutely. I've been studying the pharmacology of food for about 10 years because for myself, I went to the best physicians. I had a hormone imbalance. I was put on one drug after another, and I just became more and more sick. And then I went to a naturopathic doctor who put me on a diet and herbal treatments, and I felt amazing after 3 months. And I wanted to know why that worked when the traditional treatment didn't work. And so I became very fascinated with this topic, and I'm actually writing a book on food with recipes and the pharmacologic of how the pharmacy of how food works. Yeah, absolutely. And especially as our food becomes more genetically modified and more chemicals are placed in our food, absolutely. My grandmother actually had an organic farm, and she was in her 80s chopping wood, mowed an acre of grass every month or 2 weeks. So I know what good health looks like, and it looks like a traditional diet, and unfortunately most people in America don't get that. Yeah, it's really helped my patients, because patients, you know, a lot of them are very frustrated. They'll have gone to many different physicians and gotten the traditional tests, and they haven't gotten relief. And then to be able, what I really love about ALCAT is that they see very clearly what they shouldn't eat, what they should eat, and then when they can start rotating the foods back into their diet if they choose. And I see a big difference with that, and they like the way the test results are given to them, because it's very clear. I recently had a patient that was referred by one of the internists at one of the major universities, and they had done various testing and their tests, so she sent her to me and asked me to do the ALCAT test and some further hormonal testing. And she had hormonal imbalance, GI disturbances, and she had a rash and migraine headaches. So she was amazed, especially her rash cleared up, but she was really what she was really amazed about was taking those foods out of the diet and how much it helped her migraine headaches. She had a migraine headache for years, almost continuously, and it went down to probably maybe once a month. So she was very happy, and she found out through the test that she also had celiac disease, so taking all those foods out of her diet. I recently had a patient that had been sent to me by internists from one of the universities, and they had done all their testing. And this was a patient who had hormonal imbalance. She had bloating, constipation, rashes, and migraine headaches. And she'd had a migraine headache for years. And we did the ALCAT test. And the first thing she really liked about it was the way that it was very clear on what she shouldn't eat and what she should eat, or to try not to eat. And her skin cleared up nicely from that. And the other thing that she found amazing was her migraine headaches went away to the point where she was getting them maybe once a month, where she was having them almost every day. So she was very happy with her results. Well, it's complicated I think the biggest thing is our food has become very complex. It wasn't what Mother Nature intended. There's so many chemicals added to our food, and also there's genetically modified foods. And also, as we age, our organs don't work quite as well, so we don't have the enzymes that we need. And when we don't have our stomach acid, the food particles cannot get broken down into the proper sizes. Then what happens, that can get stuck into the diverticuli. Different bacteria can get through if you don't have enough stomach acid as a barrier. And also, when you're under a lot of stress, IgA actually will decrease, which will make the gut lining more porous. So you can get foods leaking out into the regular system and wreaking inflammation all over the body. They find different bacteria now are related with certain diseases. There's a lot of studies out about rheumatoid arthritis and Klebsiella and Proteus, thyroid conditions and Yersinia bacteria. So there's a lot of different things now that they're finding where food can actually cause overgrowth and change the pH in the intestine so that the different bacteria can grow, and that can start an inflammatory process, as well as probably the genetic modifications that are taking place in our food. We don't even know, but if it's not what nature intended, I'm sure it's very inflammatory.